Okay, hello and welcome to this pre-recorded webinar on the clinical competency exam. We'd like to today address some frequently asked questions that candidates and the people helping to prepare candidates have of the clinical competency exam. My name's Rebecca Locke and I am the National Assessment Advisor for the clinical competency exam.
And my name is Adarika Jayasinghe, and I'm the medical educator for the CCE.
So welcome, and we hope you find this presentation useful. So I'd first like to acknowledge country. The Royal Australian College of General Practitioners acknowledges the traditional custodians of the land and sea in which we work and live. We recognise their continuing connection to land, sea and culture, and pay respects to elders past, present and future. I'd also like to welcome any Aboriginal or Torres Strait Islander people who are watching for this session. So initially, I'd like to talk a little bit about how the CCE is different to past iterations of our clinical exam. The CCE is still a clinical exam, so we're examining your skills that you demonstrate in clinical practice. The clinical exam has had several changes over the last few years. The CCE is an evidence-based modern assessment that allows for candidates to demonstrate that they have met the competencies needed and skills required to practice independent general practice anywhere in Australia. Before the pandemic, the RSCGP was looking at modernising the clinical exam, previously known as the OSCE, to align with best evidence medical education principles. This involves assessment of attaining clinical competencies. This transition happened a little earlier than expected because of the pandemic and the need to have a remote clinical exam. The CCE is the next iteration of the clinical exam, and it's a flexible exam that's aligned to our everyday work in Australian general practice. You can see from this slide that the time spent examining in the exams are about equivalent to each of the exams. What has changed is the duration of each station, with the OSCE having 12 8-minute stations and 2 long stations of 19 minutes each. The RCE having multiple days of examining at either 12 cases or for borderline candidates, an additional 4 cases. And then the CCE has 9 stations, which are each of 15-minute duration, meaning that the overall examination time is approximately the same between each of these exams. The structure of the CCE is that of 2 separate types of questions. We have case discussions and clinical encounters. Whilst this exam is being delivered online, both case discussions and clinical encounters will be mixed over both weekends of the exam. Case discussions are a conversation with your examiner based on a clinical scenario. There will be suggested timings of the questions given, and the examiner will try and ensure that you move through the questions at an appropriate rate, and so you have an opportunity to answer every question that is provided to them. The examiners in these stations will give you probes when they need a little more information from you, and pre-written prompts that are standardised across the question. Clinical encounters are designed to be face-to-face experiences, but in 2022, they will be delivered via Zoom. For clinical encounters, you'll have a role player who is a simulated patient, or they may actually be the parent, child, or carer of a patient. They may even be your colleague. In the clinical encounters, you won't have interaction with the examiner through the case. You will be given a task list, and it's important that you manage the tasks within this list in your case time. So you manage how you progress through the case. Sometimes there is the gender of the role player will be either male or female for a particular clinical encounter. This might happen if it's, for example, the parent of the child that is your patient that you're speaking with. So the gender will always align with what the person presents as. So if you're speaking to a female role player, it will be the patient's mother. And if you're speaking to the male role player, you're speaking to the patient's father. Clinical encounters are most often a consultation. Role players have a script and they'll be instructed on how to use the information that they're given. If you ask a question that they don't have information for, they've been advised on how to answer that as well. In some cases, they're advised to answer in a neutral way. For example, that's all normal, I don't have any problems with that. And in other cases, they have been advised to answer in a vague way. For example, oh, I'm not really sure about that, or I don't know, I don't remember. So if you get these answers when you're having your clinical interview, it's a cue for you to move on or to ask a slightly different question that may be more specific and have the information within the script for the examiner.
What can you be expected to be examined on? Cases are typical of those you may experience in general practice anywhere in Australia. They're written based on real consultations and can be set in the urban region or rurally. They'll be assessing all domains of general practice. Cases will cover situations where you will need to demonstrate competency in clinical reasoning and decision-making, in organizational and practice processes, in medical, legal and ethical issues, population health. You may have to demonstrate cultural competency. There may be challenging communication scenarios or undifferentiated clinical situations. There may even be cases where you have to demonstrate competency in acute care and prioritization of care needs. What about COVID or EBM? As you all know, COVID information is still changing rapidly. We want to ensure a fair exam, so each question will ensure there is clarity around COVID. For example, if a patient presents with respiratory symptoms or a fever, we will state if COVID has been excluded. Likewise, we will let you know if the patient has had their COVID-19 vaccinations. In regards to evidence-based medicine, we are not sending out papers to be critically appraised before the exam. This does not mean EBM will not be examined. We could ask you to interpret a table or a graph or even a short abstract and discuss the evidence in relation to a clinical scenario.
A lot of people ask how the exam is marked and how many stations they may need to pass. There are no minimum number of stations needed to pass. Each station has a pass mark, and the sum of these pass marks will determine the overall pass mark. So you can do well in one case and not quite as well in another case, and it may even out. Pass marks for each case are set using a borderline regression method. This is determined by taking the examiner's overall impression of how you performed on the case and using maths or a statistical regression to find out, based on everybody's overall impression of that case, what the pass mark should be determined as. You can see examples of the examination marking rubric on the CCE resource website and also within the GP Learning candidate module. We are examining a process in this exam. It's not about the answer. Just because you say this person has diabetes doesn't mean that that case is passed for you. We're looking at the process that you take a history, decide which examinations are appropriate for this person, think about a differential diagnosis, how you use investigations to support or refute those differentials that you have, and the process that you go through in terms of managing a patient. This might include things like your acute management strategy of how to manage symptoms even without a diagnosis being confirmed. And it may also extend to what your underlying management principles are for a particular case and how you might think about follow-up, referrals, and other management issues that may be needed for this patient. So it's not about the answer, it's about the process of how you manage a clinical consultation. Can you enrol without either your AKT or KFP results? The answer is yes, and in fact, often you may need to. With the paper-based marking of the KFP and AKT over the last couple of cycles, the results have been slower to process. Therefore, you will need to enrol in the CCE prior to results being released. If you are unsuccessful in one of these exams, you will be refunded your enrolment fee. We are working towards having cycle alignment, so eventually you will get your results before the need for enrolment, but we're not quite at that point yet. We understand that this is a source of frustration and we're working towards rectifying it. There are multiple resources you can use to prepare for the CCE. In particular, the GP Learning modules have been written for the CCE. There are 2 available. They have several role plays within them and explanations of how we would mark those role plays as well. They're not perfect. They're examples of what a candidate may show us within a CCE. There's also on our website, the CCE preparation activity, and again, several video resources on the CCE website that you can use to think about how you would mark those examples. There's at least 7 example cases and extra videos that you can look at on the CCE website. There's also technical resources and guidelines to optimize your setup from a technical point of view. There's a video that demonstrates what you can expect on examination day. And what I think is the most important resource of all is the rubric of clinical competencies. So this is where we outline each of the criteria that go towards demonstrating a competency and what the performance markers are for each of those criteria. This is what I advise our examiners to use and what I train examiners in when they are marking the clinical competency exam. So, for example, there will be, if we're marking the criteria looking at active listening within the consultation, the performance markers will be things like allowing the patient to state their concern without interrupting them, summarising back what your understanding of the problem is, and signposting or checking in with the patient that you have understood their concern correctly. So it's really worthwhile spending time with the clinical competency documents including the rubric. There's also documents on how to avoid common errors and what the common errors have been over the last exam or two, and a frequently asked question document, which we consider as a living document. So if you have a question that hasn't been answered in that, feel free to contact us through the CCE, the clinical exam email address, and we will update the frequently asked question document with any questions that people have. In terms of preparing for the exam, the best preparation you can do is working in the full scope of general practice. When I say this, I think it's really important to reflect on what you see every day, but also what you don't see every day. So we are examining the full scope of general practice within Australia. And you may find that for your particular practice, there are particular cohorts of patients that you don't see so much of. So perhaps you see a lot of women's health, or perhaps you don't see much women's health. Perhaps if you don't see a lot of chronic disease, or perhaps you don't see a lot of men's health. So actually reflecting on what you see a lot of and what you're good at and what you think you do every day, but also taking into account that there may be parts of broad general practice that you don't actually see very much of. We're going to examine right across the board, so it's important that you consider the areas that you're not seeing on a daily basis. With every patient you see, think about that process that we're examining. Consider a structured approach to every patient you see, not just for the history and examination, but also structure within how you come to your differential diagnosis and how you approach the management of that patient. In terms of the case discussions, discussing cases with a colleague is an excellent way to prepare. Using the guidance of a random case analysis is probably the best way you can prepare for these scenarios. There is an excellent GP Supervisor Association guide on how to use random case analysis, and the original AFP paper by Morgan and Ingham is freely available on the web. Use random case analysis to prepare for case discussions. Use it with peers, mentors, supervisors, or even on your own, considering a case and asking the questions that are outlined within the guide or article. As I said on the last slide, the competency document is the most valuable resource you can use to prepare for this exam. Be familiar with it. Consider observing a consultation that you do, either having a peer or mentor sit in with you and giving you feedback based on this competency document. The other way of doing this, depending on the legal ramifications in your state and patient consent, is that you could record a case and then observe yourself and compare the competency document for different aspects of the case. So you might concentrate on your communication skills, or you could concentrate on your consultation structure, or you could concentrate on your management planning. Practicing with a friend and using cases that you've observed in practice to practice with is, again, a really good way of preparing for this exam.
In terms of how to approach a question, so you've got 5 minutes reading time, and we suggest you look at all the material given. The pages are numbered, and make sure you scroll to the bottom of the document. In your 5 minutes reading time, spend time looking at the patient summary, reading the scenario, and then for the clinical encounter, ensure that you've looked at the tasks or the instructions that you need to perform in the 15 minutes. For the case discussions, ensure that you've looked at the timing of the questions. This will allow you to plan ahead for the during the 15 minutes of case time. You can also spend your reading time thinking about the stages of a consultation and how you might structure the consultation. Think about the language that you're using and use appropriate language. Are you talking to another doctor, such as in the case discussions, or are you talking to a patient? In terms of technical considerations, the technical requirements are the candidate's responsibility. You will need to have a reliable computer, a camera, and a microphone. You will need to have Zoom downloaded onto your computer and ensure any updates have occurred well before exam day. Make sure you have a reliable internet connection and also have an alternative source if needed. This could be hotspotting from your phone. Practice troubleshooting yourself. Also practice document sharing with a buddy and how to take over remote control and scrolling in a document.
Thanks very much for listening to us today. We really want to make sure that you stay engaged with the exam process, that you do the GP learning modules, look at the information that's on our website, and open emails from the college. They generally have important information in them, particularly in terms of the timing of your exam and the day that you are going to be examined. Focus on being a great GP for your patients, and that's going to help you prepare for this exam. Thanks very much, and we wish you the best of luck in your preparation.